Good afternoon, everyone. Thank you very much for attending. I am here to present an update on this year's advancements. Since last year, the advanced medical technique known as laser iridoplasty, which you have been familiar with for many years, has been recognized as a safe and effective procedure. This technique is widely used today and plays a crucial role in helping to avoid various contraindications that could arise during treatment. The safety and efficacy of laser iridoplasty have been well documented, making it a reliable option for patients and practitioners alike. We perform the exploration techniques of OCT, optical coherence tomography, gonioscopy, and tonography, an iris scanner that provides us with important information for the treatment, prediction, and simulation techniques, etc. Here we see at the bottom left a mobile application that you can all easily download because it is free, where you can automatically take photos of both eyes, and those photos are sent to the clinic. We then provide you with accurate information about the degree of pigmentation and a 3D simulation of the results. At the top right, you see an examination of the iris in terms of colorimetry, tachymetry, 3D topography, and at the bottom right, a 3D simulation. We have conducted all the research for the past 12 years because we started from scratch, meaning there was nothing. So we have had to develop different types of preclinical studies, diagnostic and predictive applications, including even genetic tests for glaucoma and eye color genes, melanin production inhibiting eye drops, and also technological developments like the one you see at the bottom right, which is a 2021 iris scanner that performs an iris study to be able to program the treatments, helping in precise diagnosis and customized treatment plans. Patients are ultimately happy if they have not had complications, if the vision is good, if the pupil is round, reactive in a normal way as you see on the left side, and not if there is a paralysis of the pupil. The pupil becomes unreactive and large or deformed or at the bottom. Of course, patients are not happy with corneal rings, with the corneal tattoo, because the result is not aesthetic, or with intraocular lenses that cause many complications. Here on the left, we see good results from patients in terms of aesthetics and ocular health. In the central part, there are poor results from the application of laser at the iris level because a good result is not obtained. The result is irregular, or there are chronic pupil problems. And on the right side, a clinic, a technique that has gained quite a bit of popularity this past year, which is top pigmentation or corneal tattoo. But last year, I already presented the advantages and disadvantages, and I find that it has many disadvantages both aesthetically and in terms of corneal health. Additionally, just remember that if we cover most of the cornea and leave only a small central hole, we will not be able to examine the eye, we will not be able to examine the retina, we will not be able to perform a cataract operation, a glaucoma operation, or a treatment for a retinal detachment. So it's like essentially reverting these eyes to a pre-war ophthalmology, in essence, without any technological advancements, basically. Here we see the evolution, that is, it is a technique of progressive evolution, 2021. At first, we apply the laser, and the healing effect gradually removes the pigment until we can see the collagen fibers of the stroma, which is what creates the color effect through the diffraction of light in the anterior chamber. These are cases with very good results. You can see remnants of melanin next to the pupil because we do not get completely close to the pupil. So, the current technique is this. The technique, well, until last year, it was an effective, safe, and predictable technique, but it had the drawbacks of needing several phases, especially in dark eyes. The duration was brief in duration, the pain was low, we did not touch the eyes, it was a non-clinical, non-surgical technique with minimal complications, in general. But above all, this year's update is to improve it for dark eyes, which was the main challenge, because in relatively light eyes, the technique is very simple and the results are always very favorable. So it was about improving, lowering intraocular pressure, reducing iritis, reducing pre- and post-medication, reducing the number of sessions, the total length of the treatment, and achieving better results. In eyes, I repeat, in dark eyes, we call grade 4-5. So what could we do? What we have done is vary laser parameters. There are many laser parameters, including wavelength, energy, repetition rate, pulse duration, shot homogeneity, spot size, applied laser pattern, and distance between shots. And with this, we have successfully managed this year to certainly and indeed significantly reduce the number of sessions, reduce the overall length of the treatment, and also reduce the symptoms overall. So as you can see here, the pressure, although it was already below normal figures, the limit being 20, we have reduced it to an average of 10 in the first days after the treatment, significantly lowering the ocular pressure. After iritis, which a patient could notice at a level of 3 out of 10 until last year, we have now significantly reduced it, meaning it doesn't even reach a level of 1 in terms of discomfort and inflammation. Therefore, we have consequently reduced the number of medications, anti-inflammatories, and we have eliminated prednisone. For example, in the postoperative period, we have switched to using only ibuprofen. We have significantly reduced the number of treatment sessions in patients with dark eyes, and as you can clearly see here, we have reduced the total overall duration of the treatment process. Because in very dark eyes, we space the phases with 4 months in order to allow time for healing and for the eye to fully recover. And now we have reduced that time to 1 month for light-colored eyes and to just 2 months for dark eyes of grade 4 or 5. Interestingly, by varying parameters, we have also been able to offer more color results. Until last year, we only talked about blue and gray, and now we can also offer light brown, olive gray, and different colors such as, due to the variation of laser parameters. This is the research to conclude that we currently have underway, which is the automatic laser, because our goal for many years has been to manufacture an automatic laser that will be the Apolis or Tyrone, the scanner at the bioengineering level. We are developing drops to reduce the production of melanin or even substances that change the color of the eyes in a single step. The digital flare meter is a safety system we have also developed that measures the Tyndall effect within the anterior chamber when we perform the laser, which is essential to include and integrate into an automatic laser system that uses an interlock and stops the operation when the Tyndall effect in the anterior chamber rises too much. I am finishing. Here we see, this is another product we have developed, which is an iris photo booth. This video is 9 years old, meaning it is not recent, because the idea we had of an automatic laser at 100 to 200 hertz speed using what is called a flying spot method, which is not a scanning, not a line-by-line scanning. But with completely random points, we already presented the same video 9 years ago. So, fortunately, it is now a reality. We have already been able to manufacture it in Spain, in Barcelona, and this is a laboratory video of the laser from 2 weeks ago. So, the speed of the video does not allow us to see that the shots are being fired at 200 hertz per second, meaning that 200 shots are hitting the iris randomly every second to prevent a tissue reaction in the iris, making the application at the end of the entire treatment much more biological. What advantages will this give us? The automatic laser has the same properties as the manual laser I presented earlier, and the advantages it will give us are related to the patients. Patients will be able to come from both Europe and the US. And in 1 or 2 days, they will be able to start the treatment, and they will also be able to complete the treatment in as little as 6 months or even 3 months, which previously could take much longer. And that's all. Thank you very much.